Let's say we have an employer who's looking at 3 different health insurance plans. Some plans with higher deductibles, some with lower deductibles. And we also have a demand curve, the person's demand for medical services. The price would be his marginal value. Marginal means additional. Value means how much you're willing to pay, how much you value something. So this person's willing to pay $400 for the first units, as we see right here. And won't pay $401, but will pay $400. For the second unit, it's willing to pay $300, but no more. Not even $300.01. So this is our demand curve. Now, let's calculate what the prices are going to be. That is, how much the person has to pay for health care. Notice for the first one, we have a $200 deductible, $100 price. First 2 units have to be paid out of pocket. So 100, 100. After that, we can take a 10% times the $100 price, and that means this person, actually I don't mean to write a dot, but that's $10, isn't it? So after that, 10% of 100 is $10. Okay, I'm not sure why that one came over, but I thought I picked up my pen. Now the question comes up. This is how much you have to pay. This is how much you're willing to pay. So, willing to pay 400, have to pay 100. Do it. So in this case, has to pay 10, willing to pay 150. Do it. So notice down here, have to pay 10, willing to pay 20. Do it. This person has to pay $10. It's not willing to pay anything. Don't do it. So it looks like they're going to stop right there. They're going to buy 10 units of health care. And a lot of it's because of the lower price. Now let's try a $500 deductible. Let's change our colors. Let's make it look green. 500 divided by 100 is going to be is equal to 5. And so now it's 0.2 times 100, which is 20. So the first 5 units is 100. And then it's 20. Okay, notice down here, here's willing to pay 20, willing to pay 20 is over here, has to pay 20 is over here. Looks like this person's also going to get 10 units because the additional cost of the 11th unit is also $20, but he's not willing to pay anything. Let's go for the last case, which is a catastrophic health insurance, $5,000 deductible. And in this case, I'm going to change to violet, $5,000 deductible. I'm not sure why my lines are disappearing. Divided by 100. Okay, I know I drew those lines. Is equal to 50. He has to get 50 units, buy 50 units of healthcare, which is off our chart. And he's not going to be willing to buy 50. So everything this person buys is out of pocket. So it's $100, which is our price for everything. Because he hasn't fulfilled. Even if he gets all 11 units, that's only what, $1,100? That's not $5,000 yet. So how much is this person going to get? Let's see. Well, willing to pay 150. We're looking now for that 100. So it looks like the 6 units right here because he has to pay 100 full price. He's willing to pay 100. So what that means is one of the purposes of a catastrophic health insurance is people use less health care. Now, will they have better or worse health? Well, there was a RAND study many years ago, ran by, I believe it was Joseph Newhouse, and what he found was he had some people who had fairly low expenses. Actually, in their case, I think there was near zero. Some people who paid nearly all, or close to all of their health care. And what he found was people who had to pay for all their health care used about a third less health care than people who had it paid for. But since they used a third less health care, did they have worse health? And they did not, except for one group. And that was a fairly large group, which would be your chronic illness people. Now, the chronic illness people are people you want to bring in more often. And so they had slightly worse health, but overall, people were going in for things that they were going to get well on their own. But they were using scarce resources, where healthcare is a scarce resource. So that's why some people have said, let's have more catastrophic health insurance. The purpose of insurance is to make it so people don't have to bear large expenses. Well, if you're just making it so they don't have to bear small expenses, that's not true insurance. So this protects them against very large expenses. Of course, for some people, $5,000 in my example could be a fairly large expense, but definitely it gets people to use less health care. So it could be adjusted different ways, but kind of an interesting way to look at different prices. And what this program shows is people respond to incentives, where if you pay for something, you tend to use less of it. Thank you.